Here is how to obtain a patient's vital signs. First, perform hand hygiene. Turn on your vital signs machine by pressing the power button. Next, apply an appropriately sized blood pressure cuff to the patient's arm. The artery marker should be turned toward the medial aspect of the arm and not directly over the bicep. The blood pressure cuff should fit snug on the arm. The patient should not be talking or have their legs crossed during the blood pressure reading. Press Start to initiate the blood pressure reading. While the blood pressure is being calculated, you can count the patient's respirations during this time. Next, place an oxygen probe on a finger without nail polish and wait for a reading. The oxygen probe will also sense a pulse, but to maintain accuracy, palpate the patient's radial pulse. Also, show the readings to the patient. To obtain temperature, take the temperature metal probe and firmly insert it into a plastic sleeve. Then insert the probe under and at the back of the patient's tongue on either side of their mouth. Have them rest their tongue on the probe and close their mouth. To dispose the plastic cover, press the top button to eject plastic into the garbage. Return probe back to its holder and turn off the vital signs machine. Place pulse oximeter and blood pressure cuff back into the basket of the machine. If any vital sign is abnormal for the patient, repeat test, use a different machine, or if applicable, get a manual reading.